I would like to welcome Dr. David Nye to the channel today. He's an integrative medical doctor. He's also recently been appointed as chair for the South African Society of Integrative Medicine. Congratulations and welcome. I've had readers mention they've been diagnosed with Wilson's temperature syndrome. And I've had readers asking me, how would they know if they have Wilson's temperature syndrome? So I have a lot of questions for you. How is it diagnosed? How is it treated? Please just explain a little bit more about this fairly unknown condition.
It is very unknown, and it's a pity that more people don't know about it because there's so many people who are suffering with it. Typically, we find people have been to the doctor and their thyroid blood levels are all okay, and they just have a sense that they know that their thyroid is not functioning. They're gaining weight, they're feeling anxious, their hair's falling out, and yet doctor after doctor will tell them that their thyroid is fine because their blood levels are normal.
Right.
And Dr. Wilson, who's an American doctor, a delightful guy, has worked for the last 25 years with this condition, which is called Wilson's temperature syndrome. Some people call it subclinical hypothyroidism. And it's a situation where often the blood tests are completely normal, and we then have to diagnose it by using the person's body temperature, measured in the mouth, and a collection of thyroid or hypothyroid symptoms. So if the person has a whole bunch of symptoms that are fitting and their temperatures are low, below 37, then we can make a pretty confident diagnosis of Wilson's temperature syndrome.
Do you need to take your temperature then and report back to your doctor at a certain time?
I generally tell patients to take the temperature 3 times a day between the hours of 10 and 4. We don't want to do it too early in the morning or too late at night because the temperature does drop then. And they must take it in the mouth, not with an ear thermometer or any other kind of thermometer. And that gives us a pretty good idea. If they do that for 4 or 5 days, we can see whether their temperature fluctuations or whether the temperature stays low. But it's very revealing.
And you prefer the digital thermometer or mercury?
Problems with thermometers. Digital is quick and convenient to use, but it decalibrates very quickly. So if you drop it or bump it or bangs around in your handbag, it often reads inaccurately. So the compromise that I've reached is that people should get 2 thermometers. They should get an old-fashioned mercury thermometer and calibrate the digital one with that once a week. And if the 2 read the same, then they can carry on using the digital one. And as long as they calibrate once a week, they can be pretty sure of reasonably accurate results.
But why would I want to know that I've got Wilson's temperature syndrome?
Because it's very treatable. And the difference between somebody who's got an overt hypothyroidism means that they've got to be on supplementation for the rest of their lives.
Supplementation as in?
Like thyroid hormones, altroxin or tetroxin.
So medication?
Medication,
right.
Yeah.
Is there a natural supplement you can take?
There are. We have availability of a glandular natural extract called thyroid S, which is the same as almond thyroid, which one can get in the States. Thyroid S is the only one available in this country, and it's a combination of T1, T2, T3, and T4, so it makes a nice balance. And a lot of patients are very happy on it as an ongoing supplementation.
But you can't buy that over the counter?
You have to get it through doctors.
Okay, integrative medical doctors will know where to find the product. What is it called again?
Thyroid S.
Okay. So if somebody typically finds themselves exhausted and they're anxious and they have hair loss and they're gaining weight, there is hope for them. They don't just have to be put in a corner and saying, oh, you're just stressed or it's midlife, it's normal.
Unfortunately, many people are put on the heap like that. And 20 years later, when they discover Wilson's temperature syndrome, I've had patients weep because they've realized how many years of their life that they've lost through not finding the answers.
So how quickly can you get to a solution if you're on treatment?
The treatment involves putting the patient onto cycles of slow-release T3, which has to be made up at a compounding pharmacy.
Is that, how do you administer that?
It's in a capsule.
Oh, so it's ingestible.
So it's very easy. It takes a little bit of meticulousness from the patient's point of view because we need to document the temperatures 3 times a day so that we can monitor progress and when they reach their goal temperature of 37. And also the capsules need to be taken every 12 hours exactly on time which some people find a bit challenging, but it's worth the effort because the results are very good.
Right.
And we repeat the cycles of T3. The dosage will go up and will go down over a period of a cycle, which is 4 to 6 weeks. And we repeat those cycles until the temperature stabilizes at a norm of 37. And when the temperature stabilizes, then the thyroid is strong enough to work on its own.
Right. So it doesn't need to be on medication for the rest of its life.
Not unless they needed medication before that.
All right.
Because we can, with Wilson's temperature protocol, we can also treat people who are on medication and who have an underactive thyroid, but quite often they reach a situation where their thyroid is, or they're still having symptoms because the medication is not working properly. In other words, the thyroid is becoming resistant to the medication.
Right, almost like insulin resistance.
Yeah.
All right.
And we take them off their medication, put them on the protocol, and when they've finished the protocol, they probably have to go back onto their medication, but usually at a much lower dose, and it works much more effectively.
Oh. So you really got to watch your temperature. And how low would it drop? By 1 or 2 degrees?
I've had some people with temperatures of 34.
Wow.
And 35 is quite common. Even 36 is, even if somebody's got temperatures of 36.5, half a degree less than normal, and they've got all the symptoms, they can respond to the protocol.
What if it's coincidental that their temperature is low? Either their thermometer isn't working, or they take it right after they've had a cold swim, or something like that, and they're complaining with the same symptoms. Is there any harm that can be done in a misdiagnosis?
No, and in fact I've had a few people where we've started them on the protocol and then eventually found that they've done much better on bioidentical hormones, estrogen, progesterone, because a lot of the symptoms are very similar. And when you treat with the one hormone or the other, there's a lot of cross-reaction. So often the one hormone system will come right when you treat with the other. So we very seldom treat with both at the same time.
Right. So what is the cause of Wilson temperature syndrome, and why would the functioning thyroid suddenly be impaired?
That's a very good question, and stress is one of the biggest causes. We find that stress really impacts the body in so many physical ways, and the thyroid is very susceptible to stress. A diagram that I often show my patients to explain how this comes about, if I can show you that.
Yes, please.
The body basically makes T4, which is an inactive form of the thyroid hormone, and this should convert to T3, which is the active form of the hormone, and that has an impact on the cells of the body and has an impact on the thyroid. And that's how things should normally function. What happens when stress comes along is that we get an enormous outpouring of cortisol, and cortisol has a blocking effect. So it actually blocks this conversion between the T3 and the T4. And what happens then, the T4 converts to an inactive form of T3 called reverse T3. And this reverse T3 then blocks up the thyroid and it blocks up the receptors in the cells. So when the blood levels are measured, we measure normal levels of T4, we measure normal levels of T3 because it includes all the inactive ones.
Right.
And this is why it's often misdiagnosed. So if one can understand about all this reverse T3 floating around in the system, then one can understand how this condition arises.
And how it can be missed.
There is a blood test for reverse T3, but it's very expensive and very seldom done. And in fact, with the temperature diagnosis, we don't even do it anymore.
So that's an easy way. Wow, very valuable. Thank you so much for your time, David.
You're welcome.